Today's Helping Seniors TV segment takes a look at joint replacement, and program host Kerry Fink talks with Health First joint replacement surgeon Dr. Scott Miller. Let's listen in. I'm Kerry Fink with Helping Seniors TV, and it is a pleasure to be here today with Helping Seniors TV. We're live and on location at the Mega Senior Expo, which is taking place today in the Melbourne Auditorium. And this is a thing that happens several times a year throughout Brevard County, where there is a senior expo and health fair, and literally hundreds and hundreds of people come by. There's something like 70 plus different vendors and information tables here. So people can come by and get a lot of information in one place. And we have the privilege of snagging a few people who are making appearances here. And we're really privileged to have with us Dr. Scott Miller, who is a orthopedic surgeon working with Health First. And thanks for taking time out of your schedule to be with us today.
That's no problem. I really enjoy coming out to places like this. It gives me the opportunity to get out in the community and to see things not just in my office, which is smaller.
Well, they gave me some background on you. You said you're originally from Tampa, Florida. So tell us a little bit about how you came over to our side of Florida, which we think is a good side of Florida.
Actually, I'm originally from Chicago.
Okay.
Go Cubs. Cubs finally won the World Series. But Chicago is cold.
Yes.
And from Chicago, I moved to Milwaukee for medical school, and then Long Island to do fellowship training. Well, really residency first, and then Tampa was fellowship training. So I did my fellowship for a year in Tampa, and my wife liked it warmer than it was in Chicago. So we ended up moving down across the state here because I like the ocean more than the bay, and there was a great opportunity to work in the community here.
Yeah, and I was going to say, there was a note here they said about wife and baby, and I was going to just ask you.
Yes, it's weird to think, but I think I've known my wife now for almost 15 years, and we now have been married for 8-ish, and we have an 18-month-old daughter, Delilah.
Well, congratulations. That's got to be an important part of your life.
It is. You know, I like to make sure that every night I get home in time to see her before she goes to bed. So that's my goal every day I start, to get home in time.
That has to be a challenge because it says here also, too, not only are you an orthopedic surgeon, but you're fellowship trained in total joint. And I want to steer toward that, but before we steer toward that, I just want to ask you, so that's tough because as many patients as you're helping and working with, then to get home every night, that's
Yes, because I have a hard time saying no or stopping. So my schedule tends to get bigger as the day goes, and you can see I like to talk to patients. There's a lot to be said when you're talking to a surgeon, and I guess that's part of this, is making sure that you get out and see the doctor and know who you're getting. Because once we establish a relationship, we're together for a long time.
Right.
So you got to make sure that we feel comfortable with each other, and that's why it's important that we spend the time to talk. So in spite of all that, I still do try to get home every night.
And that's good, and I think that's important, but it's also important. Could you explain a little bit what fellowship training in total joint means? Because I know when you're a typical consumer and you just know things aren't feeling right and you're trying to figure out, I got to do something, and how do you even begin to know what the right things to do are then?
Sure. The thing about becoming a surgeon, it's a long process. So from start to finish, it's about 13 years when you decide that you want to be an orthopedic surgeon. But then I wanted to subspecialize specifically in doing hip and knee replacements. And then the redos, the people that have them in already that aren't very happy with them. So I spent an extra year, that was my year in Tampa. And that time is spent doing only hip and knees. So my practice is 95% hip and knee pain and management with joint replacements. And I think from a consumer standpoint, it's important that you have somebody, number one, that you're comfortable with, but number two, that's comfortable with what you need to have done. So as a fellowship trained surgeon, I feel I'm uniquely prepared to address joint problems in the patient population. And, you know, by doing fellowship training, it allows me to be up to date on new techniques and new opportunities. And I think that's something in the community that's really enjoyed, actually.
Yeah, so a question would be if you're watching this television show, and just a little background for helping seniors, we are a not for profit organization, and our mission is to get information into seniors' hands. And as you know, here in Brevard County, literally half of our people in Brevard County by AARP definition are seniors, meaning they're 50 plus, and 1 out of 4 is actually 65 plus. So Joe Steckler, who's our president and founder of the organization, he's a retired Navy captain. He did a lot of work establishing the Brevard Alzheimer's Foundation and getting all that going. Couldn't stand to be retired. He's 83 years old now, but 6 years ago he said, Kerry, I'm starting up a group called Helping Seniors of Brevard, and I just want it to be a source of getting information in people's hands, because sometimes dementia and Alzheimer's isn't the only issue that seniors face. So one of the questions is, we try to do television, radio, a lot of things that bring information to people all throughout Brevard County. So when you said the word pain, and when you were talking about knee and hip replacement, I thought about this because we archive our television programs on a Helping Seniors YouTube channel, and one of the most frequently searched out topics is pain. And so I want to say, like, how would somebody understand when it's time to give your office a call? Like, what's going on that would cause them to say, I need to take a step in the right direction about this?
So that's actually a great question. And as an aside, I think that the work that you do with all of the things that this community group does, and it's incredible.
Thank you.
To just be able to provide. I see so many people that get lost in the shuffle, and I see them, they end up in my office and they've been searching for the way there, and it's a 6-7 month process for some of them. So I think anything that you can do and provide and have as an opportunity is an excellent thing. But jumping back to pain. So what I like to tell people is, when pain becomes the primary influence on what you do in a given day, when it's that bad, you need to start thinking about seeing somebody. And that can be pain in your hip, it could be pain in your knee, it could be pain in your back. It could be any number of things. But when you've started to dictate the terms of your day, like, I golfed yesterday, we're going to have to take the next 2 or 3 days off so I can recover. Or I want to go to Disney this week, so we're going to shut it down before and after. When you've made that many accommodations, there's got to be a better way. And so those are the people that I'd love to get them in sooner so they don't make so many changes to their life. Being a senior now is so much different than it was 20 years ago. At 20 years past, you say, 65, it's time to sit on the couch. We're done. Let's chill out. Now I've got 85-year-olds complaining that their handicap is going up when they golf.
Yeah.
Or their doubles game is getting worse in tennis. They're more active than I am.
Right.
And so I'm trying to insert myself in their life to keep them where they need to be.
It is a funny statistic, because I think it's still true that 85 plus is the fastest growing demographic by percentage. And it's simply because, as you said, aging is a totally different dynamic than it was, it seems to me 20 or 40 years ago, because the advances in things. And I would assume that things that you're able to do now are really the product of so much learning, and as time goes by, it gets better and easier for people to access care that's going to make a difference in their life.
Not only that, the way we deliver care is improving as well. I mean, you go back, again, I use the term 20 loosely, but you go back and you get a joint replaced, a hip or a knee, you're in the hospital for a week, rehab for a month, you're still trying to figure out what to do. We're so much more aggressive now because patients can handle that attitude. They have the attitude of get me up and let me move.
Right.
We get patients in the hospital and they send them home the next day with a hip replacement. They get out of the hospital in 2 days with a knee replacement, sometimes sooner. It's a very different world. I think people are able to do better because of how we do things.
Sure. How would a person watching this television show sort of like look at their situation and say, it might be time to give Dr. Miller a call?
Yeah. So, like I said, we get ourselves into a position where pain is a definer, but also curiosity, right? I just don't feel right anymore. You see your primary doctor. A lot of patients can get a lot of information out of their primary care physician, and certainly accessing the tools and things that you have available to them, you know, we talk about joint replacement. Where is my hip? Well, my hip's kind of groin pain. It's not really out on the side. My knee can hurt anywhere, and the knee's pretty easy to pick out. But you get connected with your primary doctor, an x-ray can be taken, and all of a sudden, hey, look, you got arthritis. Now let's get you into the machine that gets you back into your functional state.
Wow, so that's actually a diagnosis or whatever that might lead to your office then.
Absolutely. I think anybody that's told that they have arthritis of their hip and knee is probably somebody that should be coming and seeing me.
Right, and that's like the first step. They would come to your office, sort of get evaluated.
Yeah.
You would put them on the right path as far as trying to decide, like, this is where you're at in this stage and such like that.
Sure. I mean, it would be lovely if every patient I saw had to be operated on,
Sure.
hip or knee replacement, but that's not how it works. You've got people that are in all different portions of the disease process, early, late, some more painful than others. I'm there as a intermittent guide and leading you up to a hip or a knee replacement.
And I would assume, I don't know for sure, but I would assume it probably makes sense to get in there early and sort of get a sense for where you are on that scale.
Absolutely. Studies have shown us that those that wait so long, they wait too long, and their results aren't as good as they could be. They let themselves get too brought down by the process. So, you know, historically we told people, wait till you're as old as you can manage, wait as long as you can, but that's not, I don't think, so acceptable anymore.
Now it's actually going the other direction if people are like anxious to get back out on the golf course and such, right?
Exactly it. Now it's what do we need to do to get you there, not how
Right.
long can we wait until you get back.
No, I follow that. Well, let's talk about this. If somebody was thinking like, well, this is interesting information, I should get in touch and at least explore this farther, what would you recommend? What would be a good step for them to take?
So my office is a good number to call, and I bet you we can put that up right across the bottom of the screen. I think if I do that, maybe we can put it right there.
I think they can manage
We'll
that.
try that.
We have a good team.
But we will call the office. You will call the office. We'll set you up with an appointment, and we'll go through the process. There'll be some paperwork to fill out. I'll sit down with you. I'll answer your questions. You know, we have a lot of interesting and exciting techniques, and we can bring that all in the front. You know, the anterior hip replacement is big on everybody's mind. That's that muscle sparing approach that we do, and that's what's getting our patients out so fast.
Yes.
We're happy with our knee. We're trying to use the robot more. We got a lot of good things coming in this Brevard area.
Yeah, well, I hope in coming shows, we're about out of time for right now, but I hope in a coming show we could sit down and really even explore some of those things, because I would imagine it's fascinating if we could get into some of the nuances about just how far all of this has moved forward over the years.
I think that'd be great.
Yeah, talking like robotic and things like that. I mean, the advances are amazing. Well, thank you, Dr. Miller, for taking the time to pop by and talk to us here at the Mega Senior Expo. It's really been a pleasure having you, and thank you for all the good work you're doing for helping seniors.
Oh, and you as well. Thank you very much.
All right, thanks.
Take care.